Interpreting testing results. What the report means for next steps. Getting psychological testing results can feel like getting answers and more questions at the same time. The report may be full of scores, clinical terms, and recommendations that seem hard to connect to daily life. The good news is that the report is not meant to be confusing. It is meant to clarify what is happening and guide the next step. Main Section 1. What the report is really telling you. A psychological testing report is designed to do more than list scores. It helps explain patterns. It may show why someone is struggling with focus, mood, school, work, memory, or emotional regulation. In some cases, it can help identify ADHD, anxiety, depression, learning differences, trauma-related stress, or overlapping concerns.
The most important thing to remember is this: a report does not define a person. It gives a clinical snapshot based on interviews, background history, behavior during testing, and standardized measures.
Those pieces work together to answer a few key questions. What patterns were found? What may be causing the current concerns? What strengths are present? And what support may help now? Why scores are only part of the story. Many people focus first on the numbers. They see percentiles, ranges, or standard scores and try to figure out whether the results are good or bad. But testing is rarely that simple. A score in the average range does not always mean everything is fine. A person can have average overall functioning and still struggle with attention, processing speed, memory, writing, or emotional functioning. Patterns matter more than one number. Someone may have strong verbal reasoning but weak sustained attention. Another person may show solid problem-solving ability but struggle when tasks are timed. This is one reason testing can be so helpful. It explains why a person may seem capable on the surface but still feel overwhelmed in real life. Behavioral observations matter too. An evaluator may note anxiety, frustration, effort, pace, or response to difficult tasks. That context can help explain whether a low score reflects a true weakness, stress during the evaluation, or another factor. The most valuable part of the report is often the recommendations section. This is where the information becomes practical. A report may recommend counseling, psychiatric consultation, school or workplace accommodations, behavior strategies, parent support, or medical follow-up. For example, if testing shows attention and executive functioning concerns, next steps may include structure, routine changes, skill building, or ADHD-focused treatment. If anxiety or depression is part of the picture, therapy may focus on coping strategies, emotional regulation, and daily functioning. If sleep, medication side effects, or medical issues may be contributing, the report may suggest follow-up with a physician or psychiatrist. Testing can also highlight strengths. That matters because strengths often shape the best treatment plan. Strong insight, verbal ability, motivation, or social interest can all become part of the path forward. After getting the report, it helps to ask a few practical questions. Which findings matter most right now? What should be addressed first? Which recommendations are the highest priority? What changes could help in the next 30 to 90 days? The goal is not to get stuck in clinical language. The goal is to use the report as a guide. When the findings are explained clearly and connected to real life, the report becomes more than paperwork. It becomes a roadmap. If testing results have raised new questions, support is available. River North Counseling Group, LLC, 405 North Wabash Avenue, Suite 3209, Chicago, Illinois, 60611. Office 312-467-0000. https www.rivernorthcounseling.com. If testing results have raised new questions, support is available. River North Counseling Group, LLC, 405 North Wabash Avenue, Suite 3209, Chicago, Illinois, 60611. Office 312-467-0000. https www.rivernorthcounseling.com.